This is a case of acute kidney disease. It could be either pyelonephritis or renal vein thrombosis, or maybe some another cause also. 25 years male patient complaining of fever since 2-3 days, uh, nausea since 2-3 days, and burn micturition since 2-3 days. Urine output is adequate according to the history given by the patient, and patient is having small right kidney, approximately 50% less volume than the normal one, around 5-6 centimeter in length and 2.5 centimeter in AP view. And here what are the findings is that the cortex is echogenic cortex. Second, here there is perirenal fluid. There is no any calculus in the ureter. I had already examined, and this kidney is diffusely swollen, and it is measuring around. It was measuring around 13 by 7 centimeter. And here there are some images. This was left ventricle. Patient is having little bit of bradycardia, 50 heart rate. This left ventricle was measuring 5.3. IVC was persistently dilated, was not collapsing on expiration. Normally it collapses. IVC 25 mm. These hepatic veins are marginally dilated. Liver is somewhat moderately enlarged, around 15.5 centimeter in AP view. Patient is around 55 kg. So according to the weight and body ratio and height, patient height is 5 foot 5 inch, 5.5 foot. So liver is quite enlarged. So it could be due to right side heart failure or something like that. This is the wave pattern of the IVC. There is some echogenic clot inside this urinary bladder, and this is the ureter which I had traced till mid part. There is no any calculus, but some echogenic material is seen floating. It could be blood or pus. This is the renal parenchymal thickness, not renal cortex. Renal cortex is a different thing, and parenchymal thickness is a different thing. We will discuss it later. Mild free fluid was seen in perirenal space, and this is the fascia of gerota, the fat which is covering the kidney to give some protection from the shock, external shock, mechanical shock. And this is here, this band is the fascia of gerota. Whenever it is inflamed, it becomes like this, band like hyperechoic. This is left kidney. This is the renal vein. This is the renal vein. This is renal artery at various segments. I had taken it, this waveform is taken at this point. Over here. It is just for keeping the record. This is vein. This is once again the renal vein inside the renal parenchyma. This is vein which is taken at this point, close to the cortex. This is also close to the cortex. This is also venous only, pulsatile. This is also venous renal vein. It could be due to this dilated IVC causing back pressure. This is not artery, this is vein. It is by the mistake. It was showing pulsatile, so I just thought of that it is artery. This is vein. This is renal vein only. This is renal artery and vein mix. Please don't. Please ignore this thing. This is vein, not artery. This is vein once again, not artery. This was kidney 13/7. This is renal vein.